All right, good afternoon, ladies and gentlemen. Welcome. This is a joint meeting, the first joint meeting of the 68th Legislature's Labor, Health, and Social Services Committee, so great to see everybody. You will note there are some empty chairs. Some of our colleagues are presenting in other joint committee meetings, so there will be people coming in and out, and some of you may have things in other meetings. I think Senator Hutchings, I know, does, and Senator Crum has maybe something up in another committee. So people will be coming and going. Just a note for the committee members. What we'll do is we'll take presentations on the items before you, which were submitted. My comment to those presenters is make it brief. You're going because we got 30 some and we got an hour and a half. We're going back in at 2:30, so or 2 o'clock. So very brief. If there's nothing actually to add to the request, that's okay too. That's just fine too. And then after we're completed with this, certainly if you want to follow up, there's follow-up information, or one of the members comes to you afterwards and says, hey, I like that, but provide that information to either the chairman and I, or send it to our LSO staff, Clayton, and he'll get it disseminated to the committee. And then finally, for the members of the committee, after we're completed with this, in the next day or two, staff will put together basically I'm going to say this out loud, ranked choice. So you can rank your priorities, 1, 2, 3, 4, 5, 6, however number there is, and then that'll be combined, and the chairman and I will kind of try to fit some of them into broader categories if there's multiple. Let's just say licensure, the broad licensure issue. There's several in here that are licensure. We might just say we'll take up licensures, and these are the 3 we might take up under that. So anyway, that way we can maybe get a little more work done. So any questions from the committee? Questions from the committee? So I think all of us have this summary sheet. I'm going to take the first few pages, and then my colleague, co-chairman, will take over. And actually, I do have something in another committee. If they text me, I will go. But and we're just going to go through in the order that they're presented to us. If you have more than one topic that you've requested, when you get up here, make that notation. In other words, we just might do all your topics at one time, just to help expedite the transition time, people coming up and going back, etc. If there is someone who feels, if there's a topic that comes up and there's an agency or someone here that really thinks they need to weigh in for some particular reasons, we'll allow that, but we're going to try not to make it go too long just because of the time constraints. So, Madam Co-Chair, anything? This is, I am fine not to do a roll call because we have members that are in and out, and they're going to continue in and out. So we have a generous quorum of both committees, and if that's adequate enough for staff, that's adequate for us. And we're not conducting actually any voting business or official business. With that, and I don't know if you folks have the same page as I do. I guess you do online. The first one I have is a traditional medicine inclusion on healthcare. I don't have a legislator for this one actually, but is someone here to visit about that? Kumar? No? Kumar? Not seeing that one. Next one is Representative Heiner, Majority Floor Leader Heiner, and the AA. That was a bill we had this year, so we're familiar with that as far as the legislature. So we're not, just because they're not here, we're not discounting them. They're busy, they're doing other things. So we'll just keep going. If they show up, we'll come back. Yeah, the next one is summer nutrition, children. It's under Lloyd Larson, but did he sponsor that on behalf of anybody that wants to speak to it? Summer nutrition?
Mr. Chairman.
Go ahead. Senator Scott, if you do your microphone, please.
Mr. Chairman, there's several of these nutrition ones here, and I'd like to suggest that this may be an area where we need to take a look. I was called over the weekend, week before, by an individual who was interested in some legislation that didn't make it down here, but it was the bill to restrict the SNAP, what could be paid for by it, And I asked him how much of the population was on SNAP, and the answer I got was 45%. And if that's anywhere near close, Mr. Chairman, that's something we ought to take a hard look at, and all these nutrition things, that they may be being used as a general expansion of, try to restore the old welfare system that we got rid of. Great success in the mid-90s. So, Mr. Chairman, we may need to bunch all those things together and take a look at what's really going on in this area, because I think there has been, I have no idea what the expansion really is, but I was shocked by what I heard from somebody who should have been in somewhat of a position to know. So,
Thank you.
Mr. Chairman, just urging bunching of those.
Yeah, thank you, Senator Scott. So I see one on the next page, page 3, from Representative Chestick, and I believe Representative Wasserberger, that was the bill. He had a bill that was the one you referenced, Senator Scott. So we can certainly do that as we go forward. Did you want to make any comment, Senator Representative Wasserberger? No. Quickly, please.
Thank you, Mr. Chairman. That, I appreciate you bringing that forward to Scott. I actually had not heard the statistics on how many people were using the service. I just thought it'd be a good idea if we're, using a supplemental nutrition assistance program, that we should be trying to help people get healthier. And, I've had people bring forward the issue of, well, healthier food is more expensive, and I'm actually not opposed to increasing that to helping people get healthier food. I mean, you hear some folks maybe make complaints about if they see somebody on one of those programs getting steaks or something, but I mean, I think I'd rather see people getting taken care of and eating healthy versus using that program for buying things that really wouldn't be considered a nutritional assistance. And so that's, yeah, if we could bring that up for an interim topic, I think that'd be great. And thank you for making your comment as well, Senator Scott.
Thank you. Obviously, if we take this up as a topic, we have an agency that's responsible for those programs, and they can give us some background. I don't see, Senator Larson isn't here, but Senator Representative Yin.
Senator Barlow, just, Mr. Chairman, thank you. Just quickly on the SNAP statistic, I looked it up. As of 2024, 29,000 Wyoming residents, which is 5%, are on SNAP, and that lines up with 12% across the United States. We actually have less people on SNAP.
That's probably more reasonable.
Thank you. Senator Scott is pleased that you got some information. All right, anything further on this nutritional one? Representatives in the room, we've added a couple more. Next is rural emergency services. Keep moving. Senator Crum, anything you want to add to your submission here?
Nothing to add, Mr. Chairman, other than there's 3 or 4 like this as we go through the document, and I think we could group them all into one thing to save time and maybe be a little bit more efficient. Thank you, Mr. Chairman.
Perfect, thank you. Representative Campbell, you're welcome to come up if you have anything you want to add to your discussion on massage therapist state licensing.
Yes, thank you, Mr. Chairman and Madam Chairman. So Elisa Campbell, House District 56. So a couple of licensing requests from the city of Casper. I won't say I'm speaking for the city of Casper. The massage therapist one started to be a challenge a couple of years ago with some of those organizations and businesses that were involved in other activities. Human trafficking became a challenge, and our law enforcement found themselves in a situation where there were ordinances on the books to address this issue. We actually had massage therapists, licensed therapists, come to us and say, we need help, because there are businesses popping up that are doing wrong by this industry and causing harm to the public and are engaged in human trafficking. So they came to the city. The city, of course, reached out to law enforcement. Law enforcement says, we don't have any ordinances on the book. We don't know what to do. So anytime that happens within a municipality, they automatically look to the state, right, for those enforcement measures, and there isn't anything at a state level. So have dealt with it in the city of Casper for a couple of years, now have passed ordinances to get licensing through the city. But this creates challenges because then they discover that if they're not licensed in Casper, we'll go somewhere else. And that's what they're doing. So they're going to other communities where there may not be ordinances. And so we have successfully stopped some of the human trafficking that's been going on. But they are moving throughout other communities in Wyoming because there isn't a state licensing. So that would be a priority for us, especially with that massage therapy and defining what those regulations are, defining what those certifications are, defining what that licensing looks like, in order to not only protect the integrity of the industry, but also ensure that we have the public's wellness and safety in mind, that we are protecting them from some of those things. So I'd be happy to answer any questions on that one. If there aren't questions on the massage therapist side, then it would also kind of extend to the second request I have. But any questions on that
No
side?
questions? Please continue.
Thank you, sir. So the second within that licensing would be the HVAC and the radon technicians. So currently in the state of Wyoming, I think there's one certified radon, technician who can test for and then treat for. There's one in the state of Wyoming. But you can look up how many say they are. And it's those folks, especially in the city of Casper, that's all I can speak to. But with our HVAC and radon testing and certification, what we're seeing is residents that run into a problem, whether it's HVAC related or radon, and are calling these folks that say they are certified, say they have the education, and they don't. And they come in and charge thousands of dollars and either mess things up or don't do what they said they did. And then inspectors come in and we have challenges with inspectors, but it's costing residents tens of thousands of dollars, and especially with our HVAC, because our electrical are licensed through the state and HVAC is not. HVAC has very similar work in terms of electrical, and they're not licensed. So we have folks doing repairs and installations that aren't licensed and are then causing serious fire risk and issues to residents. And they end up spending additional money that isn't necessary in the first place and puts a lot of communities at risk. So that's, I think, both, whether it's the massage therapist or the HVAC specifically as it relates to electrical. And then the radon, testing and certification. There isn't anything at a state level, so it makes it really difficult to enforce and have consistency through the state.
Okay, thank you. Just to clarify, the massage therapy, you're talking about a practice act, Title 33 potentially. And the HVAC, does that fit under the state fire marshal?
I would
Could this be
imagine.
something? Okay,
Yes, sir.
All right. Anything else from the committee? All right, seeing none, thank you very
All
much.
right, thank you.
We had another Sunbucks EBT, Representative Chestick. We don't see him, but we've kind of covered that. I see the director in the back, if the director wants to make any broad comments about, no, she's shaking her head. All right. Ms. Campbell, you actually have the next one up then, which is workplace violence. If you want to present that, if the Nursing Association is here, wants to present that, that's fine too. You're the sponsor, but if you want Ms. Stecklever to provide, or somebody to do that, that's fine. Or do it together.
I will absolutely.
The next one will be language equality and acquisition for deaf children. So whoever's, if anybody's going to present on that, please be ready. And then we'll get to Representative Clouston for some. Ms. Stecklever, we're on workplace violence, Nurses Association. Anything additional you'd like to besides what's on the page? Go ahead.
Thank you, Mr. Chairman. Tony Decklever with the Wyoming Nurses Association. So we have been trying to pass some workplace violence legislation for a number of years. This still becomes a growing problem within our facilities. And so we need to look at different types of strategies to look at people who are abusing or striking out at our nursing staff. There sometimes has been several different things that we have tried in the past. This last legislative session, we did have a reporting bill because the research does say that many incidents occur, but they are never reported. And so trying to encourage healthcare provider staff to, no matter what the infraction is, that it just needs to be reported. Doesn't mean that the person's going to be charged, doesn't mean that there's going to be any other action taken, but to really get a handle on what is occurring, when it is occurring, who is doing the assaulting, to have that data would be very, very helpful. And then from that, we could actually develop strategies on where are the real problems and what are the strategies that we can address those. So we've been working on that one.
Thank you. Co-chairman?
Thank you, Mr. Chairman. Representative Campbell, this topic has been brought to judiciary for several years. I'm just curious if there's a different duplicate request in judiciary as well as this committee.
Go ahead, Representative Campbell or Ms. Declever, either one.
Thank you, Madam Chairwoman, and Mr. Chairman. Not to my knowledge, no. And the reason we brought it to Labor Health, because it does involve health services, right? And so the good news is that injury reporting system is already in place. So it would be using that current system and just modifying the system to not only document injury as it relates to the workplace, but also violence against employees in the workplace. So how do we make those modifications so we can use the existing system to get that data and to get those reports?
Okay, thank you. And further questions? Senator Scott.
Question. Some of the violence that occurs originates with people that have dementia and don't understand what often the nursing home situation, but potentially in the hospital situation, don't understand that the person is trying to help them and just totally misunderstand the circumstances and are then violent. I've seen that. Is that part of what you're after here, or is this the intentional violence from people who know what they're doing and should know better?
Ms. Declever.
Mr. Chairman, Senator Scott, both, because it's all about we hear about professionals being assaulted and not knowing if the majority of them are coming from a long-term care facility or from our folks that are mentally impaired for some reason. So if we could gather the reports, again, not necessarily charging, not pressing charges or anything, but just gathering that data, because we know that if we saw that a majority of our assaults are coming from our demented folks, then the strategy would be to develop some education on how to deal with demented folks, how to de-escalate those types of situations. But, and we know that in the past we have had, that has been a major obstacle, because it's like, well, what about the people that are impaired? And they could be impaired with dementia, they could be impaired mental illness, they could be impaired with substances. And it's like, yeah, those occurrences happen, but we don't know the rate that they're happening, when they're happening. And so gathering the data would help us to develop the strategies to address that particular situation.
Okay, thank you. Thank you. And we do, Workforce Services is here, and maybe that's a conversation that some of you folks have offline, and if there's some opportunity there. Anything further from the committee? Thank you very much, ladies. Appreciate you.
Thank you.
Next one is language equality acquisition for deaf children, kids. Anyone here to present that? Anyone here to present that? It's actually a fairly lengthy description, priority, and results. So that is fine. Representative Clausen, I think we've got 7 pages of yours. So you can take this as quickly or as not as you choose. Go ahead, Representative Clausen, I'll just let you walk through them. And if you want the Hospital Association to present, I know you're the sponsor of these, do you want those both folks to come up then?
Thank you, Mr. Chairman. Yes, if we could have the Hospital Association do the pharmacy one, and then I can take the rest.
Great, Mr. Haynes, welcome.
Thank you, Mr. Chairman, members of the committee, Josh Hannes with the Wyoming Hospital Association. And thank you to Representative Clouston for sponsoring this idea. I know we're trying to move quickly. This is a very, very complicated program, 340B. It exists in federal statute and it's available to certain types of healthcare facilities. I won't go into the mechanics, but really what we're looking at is that pharmaceutical manufacturers who voluntarily participate in this program have taken some unilateral steps to limit the effectiveness and participation in this program. And a couple of states have implemented state-level statute that really prohibits their obstructing of participation. Courts have ruled that these state-level laws are permissible for a number of reasons, and we would just ask for some time during the interim to see what Wyoming could do, because this is impacting not only hospitals, but federally qualified health centers and other, what they call covered entities that participate in 340B that delivers a substantial benefit to our healthcare system.
Very good. Any questions on that one? Pharmacies, okay. Thank you very much, Josh. I've got mandatory insurance fraud reporting. I got Marion, Ms. Smith here, or if you want to cover it, however you want to do it.
Thank you,
Hello, Ms.
Mr.
Smith.
Chairman, members of the committee.
Great to
I'm
see you.
Marion Smith with the National Insurance Crime Bureau. We bring to you mandatory fraud reporting. The National Insurance Crime Bureau is a century-old nonprofit out of Chicago. I represent 13 states. I've lived in Wyoming all of my life. Wyoming is only one of 2 states that does not have fraud reporting mandatory within its state statutes. Wisconsin is the other. They're very close to getting that passed. This was an interim topic. I'll let you know that we've worked very closely with industry on both healthcare and property casualty. We did have some hiccups regarding language. Together, we've worked it out. We will not be a complicated bill over interim. We'll come together jointly. What I have found, though, over the interim that you should be aware of is, because we don't have this in statute, one of the important pieces that we realized was the importance of immunity for, say, an insurance agent that suspects that his or her client is now on their 3rd or 4th claim that could be fraudulent. They lack that civil immunity. And we've actually been investigating a case where we've really had a hard time speaking to the insurance companies and the agents because of that lack of immunity when it comes to the conversation. So our organization works very closely with law enforcement and the insurance companies. We have 400+ special investigative units. We have 1,200+ members, many of them the insurance companies that do business here in Wyoming. And so we respectfully ask for this interim.
Senator Scott.
Chairman, a question. Had this topic been proposed to Committee 7, they usually deal with insurance
Right.
issues, and this is broader than just healthcare. Much better.
Yep. Go ahead, Ms. Smith.
Mr. Chairman, Senator Scott, we're bringing it to labor health in that my colleagues with the health insurance, as well as what we are seeing in other states, medical fraud is becoming glaringly a problem. It also ties very handily into property casualty, where you've got staged car accidents that then involve multiple different healthcare providers that are just a few of the bad actors doing fee splitting and other issues. So together with my partners with the health insurance, we were hoping this committee might be a little light. Apparently that doesn't seem to be the case. Again, this got held up due to other issues in corporations, but we do feel that it ties very handily into healthcare. And we also investigate a lot of workers' compensation fraud. So it's premiums all across the board. And again, we say it's a victimless crime because your rates and my rates are going up. It's a $300 billion problem. And it's estimated that's costing you and I between $900 and $1,000 a year in increased premiums all across the board, from our healthcare to our property casualty, et cetera. So we respectfully ask this committee to take a look at it.
Thank you. Questions? None? All right. Thank you very much. The next one's actually insurance fraud reporting. Is this actually the same thing, Representative Clouston?
Yes, thank you, Mr. Chairman. I was bringing it really from the healthcare aspect. So it seems like they would fit well together.
Okay, all right, thank you. Thank you, Ms. Smith. Next is, are we to the cutoff point yet? 7, 8. Okay. Representative Clausen, maternal medical care in Wyoming.
Yes, thank you, Mr. Chairman. I was hoping our committee could maybe just start to develop some type of plan to dealing with this issue. I'd like to maybe get all the experts in the room and present to the committee on what ideas the state, the professionals, the hospitals can bring to us that we could tackle this as a statewide issue.
My co-chairman and I were visiting just a little bit about this before we started the meeting, and she has maybe some thoughts as well.
Yeah, Representative Clouston, the executive branch had a task force that produced some recommendations, and I think it would be in the best interest for the committee to review perhaps minutes that were, and recommendations by that subcommittee of that task force to go along with this topic, so we're not duplicating any efforts. Perhaps we can work together to get that information and see what work they have done before we move forward on the topic.
Thank you. Representative Clausen, did you participate in that subcommittee?
I did not.
Okay. Anybody else on the committee participate in it? No? Okay.
Mr. Chairman, I don't think that there were any legislators. I would have to
Okay.
check, but
Okay.
no one on this committee
Okay,
participated.
all right, thank you. But I do think, having a starting place, if there's already been some work done for any of these topics, means meaningful. All right, next one is workman's comp insurance rates, Wyoming. Representative Clausen, I see just your name, I don't see anybody else.
Yep. Thank you, Mr. Chairman. So that'd be advantageous for the committee to look at the health of the funds with workman's comp insurance. Maybe look what the actuary tables are, compare our costs to what other states are. I know we've done some recent decreases, but I believe we're still like $1.70 per $100 of payroll, where the average in the country is probably 90 cents. So again, if there's some room maybe to work with the department there to continue to lower those funds or the cost to do insurance, see if we can't make Wyoming a little bit more cost effective to do business here.
Okay, thank you. Any questions from the committee? Did anybody want to speak to this? I see agency folks here, so Deputy Director Wolf, great to see you.
Thank you, Mr. Chairman, members of the committee. Jason Wolf, Deputy Director with Department of Workforce Services. I would just comment that we worked pretty heavily with Joint Appropriations Committee last year in passing House Bill 72, which effectively gave us the authority to consider up to 5% of what we call the provision for adverse deviation on the fund, or PFAD. Basically, that's a fancy word for the excess above and beyond our held liabilities. So I think Representative Clauston's correct. We are sitting at about $1.70 average. And that is down, I think, over the 2 years from, if I remember correctly, before we passed that bill, it was $2.10 was the average per $100 of payroll. And so I think we're headed in the right direction with that bill. I would just say some of the conversations we had with appropriations and our contracted actuary were that you might give it a few years to work in to see how effective it is. But that said, I'm happy to discuss, whatever you all decide as far as other methods or ways to, make it more effective and bring down rates, Mr. Chairman.
Yeah, thank you very much. And actually, I'm sorry, Senator Steinmetz.
Thank you, Mr. Chairman, and I was going to comment on that as well. I think Appropriation has done a lot of work on this, and they receive comprehensive reports from consultants every year. So it might be something we could offload to them if the committee is amenable to that.
Thank you. The former appropriator speaking. Senator Scott, the longest serving member in the Wyoming legislature. Would you use your microphone? I still got a time to turn on his mic, though.
Mr. Chairman, this has historically been in the domain of this committee. In the reform in the mid-90s, we wrote much of the current workers' comp law, and we really ought to take another look at it and see how we're doing, Mr. Chairman. For several years, it was the major piece of business for this committee.
Thank you, Senator Scott. So, and I certainly appreciate that, and there's work being done, getting an update on what the consequences or what the trends are is great. I would also say that there's another side of this, and that's the injured workers. And are we adequately dealing with those issues as well? And I know the department deals with that every day, but maybe we need an update on that side of the equation as well. So anyway, further questions for the deputy director or for Mr. Clausen on this one?
Mr. Chairman, I would just
Please.
add too that we are statutorily required to annually report to this committee. So we do send in an annual report. I think that's in October 1st, we send that. So LSO should have multiple copies of that annual report from our actuary that kind of details the health of the fund, our held liabilities, and kind of what the rate history is, so.
Thank you. Thank you. And for the committee, the new members, you're going to get reports throughout the year. And this is a good reminder that we should probably look at them on occasion. Just saying. So anyway, all right, next one is also Mr. Clausen, Representative Clausen, payment nursing home care, Medicaid rates.
Yeah, thank you, Mr. Chairman. So this may be my number one priority. You know, I don't feel like we are currently funding even the cost of care for our nursing homes in the state. And I'm afraid we're going to start losing nursing homes. A lot of them are nearly not making it. So looking at what it would cost to try to at least fund the cost of care and keep these nursing homes available in Wyoming. You know, we're a 50-50 state, so look forward to hearing from the department what their thoughts are on that and maybe what an appropriation would look like.
I bet it would look big. Senator Scott, do you want to talk about certificate of need? No, we're not going to talk about that. We're not going to talk about that.
But warning the chairman, I think this is an important one. And it's gonna take 2 or 3 hours of committee meeting to go through the figures from health department and make sense out of them in terms of what percentage of costs we're actually meeting. It is more than a little complicated.
Yeah, it's just for the committee and for the public, I don't know the public, but there is the Department of Health for the last decade has had the health stats, which gives programmatic overviews, annual programmatic overviews of all the different programs that they do. So maybe if there's a link or something, Director Johansson could provide that to the committee. Senator Scott used that unsuccessfully, I might add, on a bill that we just dealt with. Sorry, Senator Scott. But just trying to understand, these are complex systems with payers, and it has real consequences both on the fiscal side and potentially the provider side. So very important. All right, thank you very much. I think, is it my turn or your turn? All right, we're switching here.
All right, moving on to page 9, we have Representative Gugamas.
Thank you, Madam Chair. This I brought forward after the tragedy that happened in Wyoming with the murder-suicide that happened. And the information that was released by Mr. Harshman as far as the drugs that were being used and prescribed. So I'd like to take a look at these drugs and how they are regulated. Polypharmacy has never, to my knowledge, been tested on their effects with each other. So as these doctors are prescribing these multiple psychotropic drugs and things, there is no way for us to know what kind of effect that will have on a person's mental state and their actions. Too many times we hear these horrible tragedies happening and all their neighbors, friends say, we can't believe this happened. They never acted like this before. So I think this merits diving into on the effects of these drugs. So I'd like to see what we can do for toxicology reports with death certificates. And this is a huge issue. So I'd just like to kind of war room this and see what initial steps we need to take forward to solve this issue.
Thank you, Representative Gugamas. Any public testimony on sponsoring this topic, toxicology and death certificate? Okay, seeing none, committee, any questions? Okay, moving on, Representative McCann.
Thank you, Madam Chair, Chairman. This is just a continuation of prohibition of mass vaccine testing discrimination. Well, it had some definition problems, and also we ran into some national regulations that hopefully will get rescinded over the next year, so, but I'd still like to proceed with getting this hopefully approved this time. And then the second one, is that if I go on to the second one?
Please, unless the committee has any questions regarding that topic.
Second one is explore naturopathic licensure. Unbeknownst to me, when we first started this, I didn't realize there was two types of naturopaths. Without really getting into the depth of it, you know, one's a little less rigorous compared to the other one. The one that I was representing, they actually kind of go to a very medical school-like training, and there was some definition discrepancies. So we're hopefully going to take this to committee, iron it out between the two groups, who can call what, and get this sorted out, because I think the naturopaths that I'm represented, call it the medical school one, for lack of a, you know, just to be able to describe the difference. I think we could really use those in Wyoming and improve the medical, what's the word I'm looking for? Being able to obtain medical care without having to travel to Salt Lake or Denver, that type of thing. And that concludes it.
Okay.
Any questions?
Committee, any questions regarding exploring naturopathic licensure? Any testimony on the topic? Please come forward. Welcome, Ms. Marks.
Madam Chairman, Chairman Barlow, my name is Dr. Thea Marks. I'm a licensed naturopathic physician and a fifth-generation Wyoming native. I represent the Wyoming Association of Naturopathic Physicians. We submitted an interim topic on the naturopathic medicine licensure in collaboration with Representative McCann and introduced House Bill 269, which was considered in the House Labor Committee, and after 2 days of discussion, the bill was tabled with a preference for interim study. The purpose of this interim study request is to explore the process of licensing naturopathic doctors in Wyoming. We asked the committee to establish licensure and qualification requirements, as well as the necessary regulatory framework to integrate licensed naturopathic medicine into the state's healthcare system. Key issues for consideration include licensing, regulation, and patient access. Additionally, this study should evaluate how NDs can help expand primary and preventative care, particularly in rural areas. By integrating NDs into Wyoming's healthcare system, we can improve access to medical care, strengthen preventative health services, and ensure the safe and recognized practice of naturopathic medicine in the state. I stand for questions if there's any.
Thank you, Ms. Marks. Committee, any questions? Okay, thank you for joining us.
Thank you.
We will.
Madam Chairman, there's also online comment.
On this topic?
Yes.
Okay, please bring him in, Mr. Caldwell. Good afternoon. Please state your name and keep your comments succinct on this topic.
Hi, Madam Chair and members of the committee. My name is Elizabeth Gustis, and I'm a current naturopathic medical student at Bastyr University in Washington State. I also serve as the president-elect of the Naturopathic Medical Student Association. I'm honored to be here today and to represent the international student body of the naturopathic medical students and to express my strong support for House Bill 269. Currently, there are 8 naturopathic medical schools accredited by the U.S. Department of Education, with the 9th school in process of obtaining accreditation this year. I apologize. I just had to run from room to room, so I'm a little out of breath. But granting this licensure for naturopathic doctors in Wyoming will increase access to preventative care, primary care services, and holistic individual treatment for the community. Additionally, licensure will create opportunities for future naturopathic doctors to live and practice in Wyoming. As students, we carefully consider licensure and scope of practice when deciding where to establish our careers. By supporting HB 269, Wyoming can position itself as an attractive state for naturopathic doctors and to serve and contribute to local communities. We have a lot of training in primary care services to provide those holistic patient care-centered fields, including midwifery, women's health, adjunctive oncology care, prevention, and mental health. Furthermore, we have training in minor surgery, such as skin biopsies, incision drainage of benign cysts, wart removal, and stitches. These are important parts of primary care and preventative health. We also have training in pharmacology. Although we prefer to use natural approaches first, there are cases where pharmaceuticals may be needed, and we're prepared through our training to prescribe and de-prescribe medications. We urge you to support the interim topic to request naturopathic doctor licensure. Thank you for your time and thoughtful consideration on this matter, and be happy to answer any questions you have.
Thank you, Ms. Gustas, for your testimony. Any questions, committee? Okay, seeing none, thank you for joining us. Any further comments on this topic? Okay, seeing none, we'll move on. Representative Ottman. Random drug and alcohol testing.
Thank you, Madam Chairman and committee. With, listening to all of these topics so far, they kind of go together with the testimony of insurances and employers and all kinds of things like that. Anyway, and the cost of care and how to improve that. What I'll say is with random drug testing, the reason I brought this is because throughout the years, I have worked for employers that have had random drug testing, and it not only improved workplace safety, but it brought people into compliance with policy as far as different things that could go on, but it also took down our insurance rates. There's lots of, like the Federal Motor Carrier Safety, they already do it. Lots of construction companies already do it for safety reasons primarily, but it's not required in Wyoming. It is not required at all. And people can refuse to take the test, but if it's the policy of the employer to have it in place, then they would have to consider looking elsewhere for employment. It's a wonderful test for lots of things. We see mental health, people are having lots of mental health issues, whether it be from, as we saw in our committee meeting the other day, prescribed drugs or possibly other things that people are taking. We know that women are suffering dreadfully from postpartum things. So just to look at this, to say randomly, then that way this is a person that does not have this as a habit. So I would just ask that the committee would consider it, because it does cross so many issues and can identify, can save money, identify, help people to be better employees as well as family members and people in society. So it's meant to help people. So I'd stand for any questions.
Committee, any questions? Representative Ottman. Okay. Representative Ottman, looks like you have two that are very related. The relationship between mental health, disability, and drug abuse, and then suicide and drug and alcohol abuse.
Yes.
If you would briefly go over that, and then we'll open it up for comment.
Okay, thank you, Madam Chairman. Yes, these really are, and this has been, being back on labor health, I was on labor health on my first term, and then being back there again, we just see where society is struggling so desperately. In the school districts, we're looking at children that, because of behaviors and things like that, they are, it's being suggested that they might be better off being on medication, but there doesn't seem to be there doesn't seem to be the follow-up. It's like, well, if you have a problem, then please come back, make another appointment and come back. So what I'm hoping is that we will just shore up these things and make them better for people, especially in rural places where people have to take off work and take the children out of school, make an appointment in town, go back, all of these things. And as we look at, and this goes up with Representative Guggenmoss as well, is when we look at young people and the incidence of suicide that is increasing just phenomenally, and we look at why are they doing this? What is it? And there aren't the toxicology reports. I asked some law enforcement about that because I thought, well, surely they do it. But they have to know really what to look for. And the toxicology reports that are being taken are not being distributed. That data is not being used. So what my hope is, through an interim topic, that we can bring all of these things together and just say, okay, what can we do for our people? What can we do for our mental health providers? What can we do for law enforcement? And what can we do for our children? What can we do for our teachers? And what can we do for society as a whole?
Thank you, Representative Ottman. Committee, any questions on these two topics? Okay. Department of Workforce Services or Department of Health, any comment? No? Anybody else? Seeing none, we'll move on. Thank you, Representative Ottman. On to page 12. Representative Ottman, you've got one more. Report on Lander Resource Center.
Yes, thank you, Madam Chair and Committee. This Lander Resource Center is something that has been in the community for a while. The reason I asked for this report, or for it to be a topic, is because it is a major employer in the community, and it does a lot of things. But there's so much going on there, like when it was incited, how much money's been spent, when they're expected to be finished with construction, does it help with the state hospital? What all businesses are there, and all of those things is a mystery. And so while I've been able to go over there and tour it a couple times now and found that it was a beautiful property and they were moving forward, looking at a day in which it's difficult to get employees, and especially for a work like this. I worked at a state home for a while, and it's not an easy task. It is not an easy task. And so I was just hoping that we could get a report on when this might be finalized, when it might be full capacity, if ever, or just basically what's going on. And so I would appreciate that consideration.
Thank you, Representative Ottman. Chairman Barlow.
Thank you, Madam Co-Chairman. So the Department of Health has multiple facilities. I think it's actually would be good for us to understand all the facilities and what they do, what their budgets are, because that's what we'll be dealing with in the next session. The budget session is both the programs and the budgets for those. So I think it's appropriate for all of our agencies. By the way, I just throw that out there that the co-chairman and I were visiting a little bit, and having an overview of your agency functions, programs, and budgets would be very helpful in informing ourselves. I know I said it earlier, I'm going to say it again. That's what we're going to be doing next session, is the budget. So understanding not only what this particular facility does, but the entirety of labor health, which if you hold your hand up, those 5 fingers, that's where general fund money goes, and Department of Health is this one. It's the biggest one of general fund dollars, outside of, general fund dollars. So it's very significant. So thank you, Representative. Thank you, Madam Chairman.
Further comment, committee? Seeing none, any public testimony on the topic or public feedback? Seeing none, we'll move on. The next one's mine. And I will turn the floor over to the Hospital Association to present the topic. Mr. Boley, welcome.
Thank you, Madam Chairman, committee members, Eric Boley with Wyoming Hospital Association and Leading Age Wyoming. The topic that we brought here is the use of AI in prior authorization and termination for coverage. And as you're all aware, AI is becoming a bigger and bigger issue in our country. The reason we brought this, I think a great example, and many of you have probably seen what's happened with United Health over the last period of time. United Health used artificial intelligence to do their prior authorization approvals, and they used an algorithm. We saw 50% of the prior authorizations denied right up front without any review. Afterwards, over 70% of those were overturned when an actual person took a look at those. And so I don't think we have a huge problem here, but I think we can be preemptive. And what I'd like to look at in the interim, what we've suggested is the use of AI in conjunction with a human being, someone trained, taking a look at those. I don't think it'd take a whole lot of time, and I think this just further accentuates the work that we've done the last 2 sessions when it comes to prior authorization and our partnerships with the insurance companies, and then what we were able to do during this session with credentialing. So that's why we brought this one forward.
Thank you, Mr. Boley. Committee, any questions on the topic? Okay. Seeing none, thank you.
Madam Chairman, if I could, I
Mr.
didn't come
Bully.
up because I knew I was going to be sitting here, but there are a couple of the interim topics that have come up that we'd just like to add our support to. I represent all of the nursing homes in the state, and I think taking a look at Medicaid reimbursements, super important. I think Senator Scott did a great job of trying to share some of those figures on the floor of the Senate, but there is a big discrepancy, a big problem with what we're actually getting paid compared to what the cost of healthcare is. So I would, hopefully we can take that one up. On the masking thing, I would ask you to not take that one up. I can't think of how many times in the last 5 years that we've looked at masking, vaccines, immunizations, discrimination. If what Representative McCann says is true, and if the federal government does finally roll back the final part of masking, there's really no need for this legislation. But we've spent, I'd say, almost 100 hours on this thing over time, and I just think it's unnecessary. And then finally, I think the OB deserts, the OB issue is a big problem that's continuing to grow, and I would hope that we could take that one up. I do think through the Governor's Healthcare Task Force, we can provide some really good information of what's been done and some ideas. And then finally, EMS services. I know it's coming up as a topic here shortly, but it's another area that we're really struggling in our state. We've tried to do some Band-Aids on that problem, but I really think it's an important one as we look at emergency services in our state. With that, I'd answer any questions, and I thank you for indulging me.
Yep, thank you, Mr. Boley. Any further, you have a question for Mr. Boley? Senator Scott.
Mr. Boley, is it not fun to refight all the COVID wars with 2020 hindsight?
Madam Chairman, Senator Scott, it's been a blast, and I've really enjoyed it a lot. And so if we need to do it again, let's do it. Thanks.
Committee, any further questions or comment? Mr. Boley. Okay, seeing none, thank you for joining us. Any further public comment on the AI topic? Okay, seeing none, we will move on, and it looks like next we have Representative Wasserberger. We're on page 13, childcare sustainability.
Am I allowed to speak? Okay, thank you, Madam Chairman. Yeah, I wanted to just bring this up as a subject to discuss. There is some things that I'm a little, I think that we're gonna have to put a lot of thought into about this, but I know with some of the legislation that we passed earlier, we're kind of trying to be in the mindset of encouraging to have more children or to making things easier for people to have, encouraging more children. And so I'm just trying to think of solutions to maybe making access to daycare maybe more affordable, more accessible. And so I think maybe just taking some time to do some research on this and to kind of looking into more of some of the things that we could do to make daycare a little bit less regulatory, to opening up these businesses again, I think would be kind of essential for our state. My mother did daycare for 30 years, and it's gotten regulated to the point where it's almost impossible to open up a daycare now. And so I think with you know, some of the previous legislation that we passed this year, we're gonna need to be finding solutions to making this more accessible for people with children.
Thank you, Representative Wasserberger. You have a co-presenter? Ma'am, please introduce yourself.
Hello, my name is Micah Richardson. I'm with the Wyoming Women's Foundation. Our mission is economic self-sufficiency for women and opportunities for girls. We propose these topics specifically because we know the funding model, which rightly prioritizes children's safety, makes it a little bit difficult to be a business that can sustain itself. And so the two topics that we proposed are a TRICARE share model, which looks at employees, employers, and then the state putting in funding to have a sustainable model to support childcare. And then we also have recognizing that infant care is the most tricky to make a profit on, just due to those margins. We feel the safety of children is really important, but we also recognize that you know, there's likely going to be a multi-pronged approach that is needed, and we believe exploration by the state of additional support, and we are proposing monetary support here, I'm not going to beat around the bush, is important to try to figure out how we can sustain childcare, especially in our small rural communities. And I'll leave it at that, unless you have any questions.
Thank you. Committee, any questions of Representative Wasserberger or Ms. Richardson on the topic? Comments? Seeing none. Thank you, ma'am, for joining us. We'll move on to page 14. Representative Yin, medical cannabis legislation.
Madam Chairman, I don't know if there's anyone here that's going to present in front of us, but generally I've been supportive of anything that puts a structure in place, especially just in case something happens in the federal level. I don't want to get us caught off not on the right foot without having some sort of structure in place. So generally supportive of that, and I think that something like that should happen during an interim committee meeting rather than as a personal bill. That's all.
Thank you, Representative Yin. Committee, any questions or comments on the topic? Seeing none, we will move on. Chairman Barlow, maternity care deserts.
Thank you, Madam Chairman. I think we've kind of covered the maternity care one. Mrs. Decklever is coming forward if she wants to add anything to the discussion from earlier.
Ma'am, please state your name and we'll hear your comments.
Thank you, Madam Chairman. Tony Decklever with the Wyoming Nurses Association. We realize that our state is struggling providing maternity care to many of our residents. And with the closure of some of our OB services, it just has become a real problem. So one of the things that Montana has put together a program that helps to educate their emergency room folks and some of the family practitioners that are in their communities to deal with labor and delivery and maternity types of issues. The other thing is that, and it's just an add-on, it could be part of what Representative Clouston also is looking at, because he's got something here too for maternity deserts, but and it adds to the two after this that Alicia Lepard with the Advanced Nurse Practitioner group has put together. If I am a certified nurse midwife, I can have my own practice. I can hang a shingle, I can see patients, and I can deliver, but I can only deliver in a home. And so, or a birthing center. If I am a certified nurse midwife, but I'm working for a doctor, now I can go into the hospital and I can actually deliver the baby in the hospital. But if I'm not working with a practice or with a doctor, I can't do that. So it is prohibitive for nurse practitioners to be able to apply for admitting privileges to our hospitals. And so we would like to change that in statute to add APRNs. We have, APRNs have full practice authority in the state of Wyoming, and we would like them to be able to practice to the full extent of their licensure. So with that, I would take any questions.
Thank you. Committee, any questions of Ms. Decklever? Okay, comments?
Thank you.
Thank you for joining us. Chairman Barlow, continue, dental insurance.
So dental insurance is Mr. Gopian here. He wants to walk through. This is related to a bill we have this year. Mr. Gopian, if you'd like to outline this one for Madam Chairman, if that's appropriate.
Please.
Thank you, Madam Chair. Nick Agopian, representing the Wyoming Dental Association. I don't know that there's a ton more to add to this. I'd probably be speaking directly to the Senate committee members who held the hearing on Senate File 159. That hearing evidenced the need for more conversation, the likelihood of a policy decision, and the request is for the committee's time, ideally towards the end of the interim. I think before we would come back and get in front of this committee, we would need to follow up with some of the insurance providers in this state, see if we can't get closer to that 80-20, and that may not be likely. But certainly, I think we need to, there's some more work to be done on our end before we'd come to the committee, and we asked to reserve the opportunity to bring this back to the committee late in the interim.
Thank you, Mr. Gopian. Any questions, committee? Comments? Okay, seeing none, thank you for joining us. Chairman Barlow, Healthcare Parity Act.
I don't see Ms. Lepard here. She's not online. Ms. Decklever actually kind of spoke to this just a little bit. This is has to do with, I guess they call them mid-level practitioners and their access both to facilities to provide to have admitting privileges and the coding and their ability to be reimbursed for those services. And that at this time, often they are reimbursed at a different level for the same service than a physician would be. So this is two different things, and maybe physician's assistants fall in this category too in some places. But anyway, this was something that I've been hearing about for several years from Liz Lepard and that organization. And certainly, I started drafting a bill, and then it was suggested that it would make a really nice interim topic by some folks. So that's why it's here. Thank you, Madam Chairman.
Committee, any questions or comments? Senator Scott.
Madam Chairman, some of the things I'm starting to hear in my community, I wonder if the access to facilities doesn't extend to medical doctors as well as a problem. And it sounds like there's a problem developing there.
Chairman Barlow? Okay. All right. Is there any public feedback or comment on this topic? Seeing none, we will move on to another page of Chairman Barlow's topics.
Thank you. Thank you. It goes under emergency services. I think we've kind of covered that several times. Mr. Laycock's here with AERP. If you'd be willing to take just a few comments from him, thank you.
Welcome. Please state your name and we'll hear your comments on the topic.
Thank you, Madam Chairman. Tom Laycock with AARP Wyoming. We're a membership organization for those age 50 and over in the Cowboy State. The issue we're bringing before you today is studying EMS a little bit deeper. So EMS is an issue that's very nuanced. It's not boring in the least, which I say that you kind of laugh, but it's sort of fascinating when you dig down into it. Now, interestingly enough, the state of Wyoming has seen 16 EMS organizations or ambulance organizations fold or consolidate in the last 10 years. There's a lot of questions about why that is. A lot of it obviously comes down to payment. And we've got some kind of new thoughts moving forward in terms of what we can do using our friends at the Department of Health that probably warrant a good policy conversation on this. There's also a lot of other things going into it in terms of, for example, volunteer. We're about 200 people down in terms of volunteers for what we need for EMS in the state of Wyoming. It's a great time to have the conversation once again. Like I said, nuanced, never boring. We appreciate you thinking about it. And I know there's a lot of new faces on this committee too. It'd just be great to get your perspective, see what you can offer, and use your experience. So that said, I'll stand for any questions.
Committee, any questions or comments? Thank you, Mr. Laycock, for joining us.
Thank you.
Any further public input on this topic? Okay, seeing none, we'll move on. Chairman Barlow.
Thank you. Sorry, Madam Chair, my microphone wasn't on. So anyway, so this is just have a discussion about how you get more part-time employee access to the state system, if that's prudent or not, and what that might do. So thank you, and the consequences of that. Thank you, Madam Chairman.
Committee, any questions or comments for the senator? Senator Scott.
Madam Chairman, I would comment, better talk to the Appropriations Committee ahead of time because they have traditionally handled the state employees' insurance.
Thank you. Senator Chairman Barlow.
Thank you, Madam Chairman. And I did make that suggestion to the bringer of this as well. I don't know if it got on their topic list, but I did make that suggestion. Thank you, Madam Chairman.
Committee, any further comment? Okay, public comment on part-time employee benefit eligibility and limitations. Seeing none, we'll move on. Committee, the very last page brings us to Senator Hutchings. Hospital employees drug and alcohol test.
Thank you, Madam Chair. This is Senator Larson's topic. He asked me to submit it for him, and I don't see him in the room. But this is a topic about our medical profession and how sometimes they get addicted to drugs. And sometimes when they get hired, they will be clean, but we don't do random testing, and that's what he'd like to see. I remember when I was young and living in an apartment in Colorado, my dentist walks to a house that was known as a drug house. He walked in and walked out, and guess what? I never went back to him. So I think it's an important topic that sometimes our medical professionals get addicted to drugs and they need to be tested occasionally. So thank you.
Thank you, Senator. Committee, any questions or comments on the topic? Vice Chairman Ottman.
Thank you, Madam Chair. And I would just ask the committee to consider combining 3 or 4 of these different topics into one day with all the different professionals.
Thank you. Any further comment, committee? Seeing none, we'll open up to the public. Any feedback or comments on this topic? Oh, sorry, Representative Wasserberger, please.
I might be a little out of line here, but just to add to the discussion, I think I saw we had our summer food program that we're adding. I'd just like to add my SNAP benefits waiver request, even though those may be 2 separate bills down the road. I'd just like to add that into our discussion as well.
Thank you, Representative. Committee, any further question, any further comment on Senator Hutchings' topic? None? Okay. That concludes the last topic for this committee. Chairman Barlow, you want to bring us home?
So we have numerous agencies in the room, and I guess if with my co-chairs, well, I guess she doesn't give me permission, I'm just going to give the offer. Those agencies are dealing with a lot of changes at the federal level, and some of those may require some adjustments, whether it's in unemployment or healthcare, et cetera. So if you know of anything now, I see several agencies here, if you know anything now that you want to give us a heads up on that you're concerned about or interested in or following, tracking, please give us that heads up. And I think we're going to try to maintain some flexibility with our topics that we can address something if it comes up during the interim, particularly when it comes to a federal type of action, mandate, program, et cetera. So if there's anybody, any of the agencies in the room that have something that really is on their radar, they're concerned about, I just assume we get a little bit of a heads up now if you know about it or if you have it. And then we'll be more prepared and better able to just kind of give us something a little open-ended at that point. I know Senator Scott will have probably a comment. Do you want to make a comment now, Senator Scott, or do you want to wait till afterwards? Senator Scott.
Mr. Chairman, I would say from past experience, if they require legislation, you're likely to get a flood of it in just before the 1st of October, given the federal deadlines. And jimmying the meeting schedule to accommodate that kind of last minute thing may be something that the chairman ought to think about.
Thank you. Well, good advice from our long-serving member. We'll start with Department of Family Services. First, even I know you got to hear first, Director Johansson, but Go ahead, Director, great to see you. Anything on your horizon you see that's, would be of interest to the committee?
Thank you, Mr. Chairman, Madam Co-Chairman, and members of the committee. My name is Corin Schmidt. I'm the Director of the Department of Family Services. And to Representative Wasserberger's point, I do think that we're going to see quite a bit of conversation around SNAP. We received a letter from the new secretary kind of outlining some of the thinking around flexibilities, et cetera. I've also heard discussion about potential reduction in benefits, or the flip side of that, increased requirements that then make eligibility a little bit more difficult. But all the same, we are expecting some level of conversation around the SNAP program.
Thank you, Director. Do you expect that to require legislative action, or is it appropriation type action? Please.
Mr. Chairman, I would expect if it does have any impact, it would maybe be around appropriations or a policy discussion about what the state would like to do in response to any potential reductions. So maybe a combination of both policy conversation and then an appropriations. It's really hard to tell at this point, other than just flexibility, which I think is something that is a policy opportunity. So if there's some flexibilities that we want to explore with that particular program, then it may require an appropriation as well.
Okay, thank you very much. Questions for the Director? Questions for the Director? All right, thank you. Director Johansson.
Thank you, Mr. Chairman, members of the committee. Stephen Johansson with the Wyoming Department of Health.
Would you pull that mic up a little closer for us, please? Thank you.
Happy to, Mr. Chairman. So I'll be brief. I remember fondly when Senator Scott chaired this committee years ago and used to put federal issues as an agenda item. So I think we're very much back in those days. Over the coming weeks and months, we are tracking potential changes at the congressional level, primarily to Medicaid programs around the country. We're actually in a unique and good position to provide this committee reports. We just don't know the timing. So we know over the coming 2 to 3 weeks, there will likely be, recommendations or changes potentially coming out of the House. That obviously has to move over to the Senate side. The areas that we're watching pretty closely are around federal match rate changes, potential reductions, upper payment limit or supplemental payment programs that can involve hospitals, nursing homes, physicians, ground EMS. Those are programs that have been in play in the country for many years, including in Wyoming. There could be potential changes there. And then we've also heard and seen concepts around per capita caps in Medicaid, block granting in Medicaid. Those seem to be maybe less on the table now. But the reason I bring those up for the committee's perspective, back in 2018, 2019, a lot of these concepts were being discussed congressionally through the Better Care Reconciliation Act. We modeled and analyzed a lot of those factors for Wyoming, so we've dusted a lot of that off, are ready to provide this committee with some of those potential impacts or policy options around changes at the federal level and provide that to our congressional delegation as well. Mr. Chairman and committee, both on federal changes that could be impending, as well as every topic that's been discussed today, a lot of mention of the Department of Health. As always, we're ready to provide the committee with the best information analysis we can produce and help guide those discussions. Happy to answer any questions, Mr. Chairman.
Thank you. I think the only thing I heard was federal issues, and after that, I zoned out. All right, anything else? Thank you, Director. Any other agencies? I see a couple more in the room. Nothing additional, nothing additional. Is there anything that we missed in this, going through this rather quickly? And thank you for your brevity. Anything we missed in this that somebody wants to highlight? Anything we missed that someone wants to highlight? Go ahead, Director, please.
Thank you, Mr. Chairman. Coming back around to the supplemental, the summer EBT program, the eligibility benefit transfer program, sorry, getting my words a little messed up. I did receive a note that the First Lady is going to be talking to a summer food program as well in the department with education, the Joint Education Conference on Wednesday. But just so that you know that conversation has been brought up twice here by legislators, and then it'll also be discussed in Joint Education on Wednesday.
Yeah, thank you. It's a good reminder for the committee and for the public is that that's what management council's role is, to kind of deconflict some of these. So if an insurance issue is more appropriate in committee number 7 than committee number 10, or EBT is more appropriate in one or the other, hopefully that's where that gets dealt with and we're not duplicating. Occasionally there's an issue that so cross-pollinates that the committee says, you two committees form a subcommittee and figure this out and then take care of it occasionally. So anything, does the committee have anything else? Any of the members of the committee have anything that's come to mind or of interest or concern? No, you're not on the committee, Anna. You can't talk. You're more important than my committee. What do you need? Go ahead, please, Ms. Johnson.
Mr. Chairman, just so you're aware, Ms. Talbot's going to be polling you all about your materials preferences, whether or not you want them by email or paper or what have you, so be on the lookout for that. And other than that, I don't think we have anything, but thank you.
So the committee, you should anticipate receiving some kind of a polling platform of some sort that you can rank your choices for this. Sorry, we're going back to ranked choice again. And then the chairman and I will figure out how we can get us abroad. As one of the things that the chairman and I talked about is just that overall look at each agency. And I think that is probably the foundation of what the work we'll do. So I just say, it's the third time I've said it, but I really do think it's important. So anything further, Madam Chairman? All right, we are adjourned. Thank you very much for all those who attended and didn't say anything. We appreciate you.
Big silent crowd.